Eurovision is a fish test that Cyanogen, a company from Abbott Molecular, is offering online to be interpreted by pathologists. The test is used in people with hematuria to detect transitional carcinoma of the bladder. Urovysion performs better than cytology for both low-grade and high-grade transitional carcinomas. Sensitivity of cytology for low-grade is 20%, for Urovysion 50%. In high-grade lesions, sensitivity of cytology is 80–85%. For Urovysion is close to 95%. An important question: what happened in a patient with cytoscopy and cytology positive with Urovysion fish negative? Well, in this case the diagnosis has to be based in cytoscopic and cytologic findings. Urovysion is based in the interpretation of 4 chromosomes. The CEP3, 7 and 17 are very close to the centromeric area. CEP3 detected with the red filter and red signal. The CEP7 detected in the chromosome 7 with green signal and green filter. The 17 CEP17 in the chromosome 17 detected with the aqua or blue signal, and the 9P detected with yellow signals. 9P is also called LSI, locus specific identifier. A summary of the technique: centrifuge avoided urine sample, apply pellets in 3 circles, dry the sample, look at the circles and pick a circle with 100 to 200 cells per fill, enzymatic process for DNA denaturalization, preparation of the probes, hybridization, and finally counterstaining with DAPI. This is an example of normal cytology and completely normal Urovysion fish cell. 2 red signals for both copies of chromosome 3, 2 green signals, both copies of chromosome 7, 2 blue signals, both copies of chromosome 17, 2 yellow signals, both copies of chromosome 9. This is a high-grade cytology, and this is a obviously abnormal cell with the Urovysion test. The most common abnormality is trisomy. Trisomy is 3 signals in three signals in red, green, or blue. But sometimes is even worse. For example, if we count here, we have for the red chromosome, for the red signals at chromosome 3, 1, 2, 3, 4, 5, 6, 7 signals. For the green signals, chromosome 7, 1, 2, 3, 4, 5, 6 signals. For the chromosome 17, the aqua, 1, 2, 3, 4, 5, 6 signals. And another very important question here: where are the yellow signals for the chromosome 9? Well, they are absent. This is a homozygous deletion of the chromosome 9. Both yellow copies are absent. This is a very common abnormality identified in high-grade transitional carcinoma with the technique of fish Urovysion. Some important recommendations that I found in the Eurovision homepage to count the signals. An image like this one may correspond to a twisted nucleus. So if you count 2 signals here, that may be a mistake. It is only one. What happened here is that the nucleus is twisted. So ignore this kind of situation. This kind of signal that appears diffuse is not a problem. You count. So we have here 2 signals. Again, ignore overlapping nuclei. And when the signal is splitted like this, you count one signal. So here we have two signals, this one and the splitted one that is counted as one. More examples. 3 signals of the same color, trisomy. 4 signals of the same color, tetrasomy. This is 3 signals, 1, 2, and the splitted one you count like 1. The DAPI counterstaining with the blue filter is very important for the technician, because the technician can identify the nucleus in blue color, and he can differentiate the normal from the abnormal. These kind of cells are homogeneous, all nuclear sizes identical, periphery of the nucleus very regular, normal cells. These 5 cells here are morphologically abnormal cells. The tech can identify that the cell is enlarged, the nuclear border is irregular, and he has to count 25 morphologically abnormal cells to stop the counting. This is the kind of cell that is important for the technician: a morphologically abnormal cell, enlarged, irregular nuclear border, and with the DAPI counterstaining you can even identify clumping of chromatin with these patches here, another indication of the abnormality of the cell. Interpretation of a positive result. Positive is gain 3 or more signals of 2 or more chromosomes. In other words, in a single cell you need gain of signals in 2 colors, red and green, red and aqua, or green and aqua. Only one color is not enough. The other indication for positivity is a loss of both copies of the chromosome 9p. Both yellow signals are absent, both, not one, both. Hybridization failure. Both copies of chromosome 3, 7 and 17 have to be present. In other words, you need 2 red signals, 2 green signals, and 2 blue or aqua signals. Only one signal is considered a hybridization failure. Test has to be repeated if the control is not good. If the tech cannot find 25 morphologically abnormal nuclei, if the background is intense with staining artifacts, something that happen commonly with a lot of neutrophils or a lot of bacteria, if many signals are out of the nucleus, or if the intensity of the staining is very weak. Record of cells. Again, do not count normal cells, do not score. Score is based in 25 morphologically abnormal cells, large or irregular nucleus. A positive result is more than 4 cells with gain in signals, more than 3 signals, in 2 different chromosomes. So you need a cell with gain in 2 colors, red and green, red and aqua, or green and aqua. Another positivity is more than 12 cells with homozygotic loss of the 9p. Same thing, no yellow copies, both yellow copies absent. What happens if morphologically abnormal cells are not easily identified by the technician? The technician has to scan the entire sample. What happens if the technician is near cutoff, if the test is borderline positive? Well, another technician has to revise the specimen and verify the result. If this technician cannot solve the problem, the slide preparation has to be repeated and the process performed again. What happens if the results are not consistent with clinical findings? In this case, the technician shows the case to the pathologist. Limitation of the technique. It is well known that small tumors less than 5 millimeters may be negative because Urovysion depends of good amount of tumoral cells. If the tumor is very small, you may not have enough cells. Again, test with abundant granulocytes or bacteria. The background may be very intense and the test not informative. What happens if a test is positive but no tumor is cytoscopically present in the bladder? The tumor may be malignant and may be present in the urethra, ureter, prostate or kidney. Last important consideration, BCG or chemotherapy. Both BCG and local chemotherapy may be problematic for the interpretation of cytology, not for Urovysion. Urovysion is unaffected by BCG or chemotherapy, an obvious advantage for the FISH technology. Finally, the references for this short presentation, I use abbottmolecular.com, cynogen.com, the Urovysion cancer kit, and a picture was taken from an article from Acta Cytologica. Thank you.